Guys, we are on the way, driving about 45 minutes to go get one of my favorite alternative treatments for myofascial pain. This one is specifically for facial pain, targeted Botox injections. I found these by accident. I was referred to this dentist for a different reason. There I saw a sign on his counter that said, "We offer Botox injections for the following," and it listed some things. One of them was TMJ, which I have. I gave myself TMJ. I had this bar trick I like to perform. I could stick my fist in my mouth, and I did it a couple too many times. But on the bright side, it did get me on MTV one spring break, which definitely cool. This facial pain, so I assumed that that's where it was coming from. So I asked my dentist, Dr. J, about getting the Botox injections for TMJ. He started asking me about what kind of symptoms I experienced, things like chronic headache. I have headaches that often would sit behind my eyes. There would be one here, there would be back here, maybe on the side, and he said, "Oh, those are cluster headaches." I was just clenched 24/7. I had a lot of tension in my forehead, a lot. That prevented me from sleeping, which was triggered by my myofacial dysfunction. This is a physician who was already familiar with myofascial, so luckily he convinced me, not the other way around, to try this. He explained to me how it works. It is a godsend. It is incredible. The downside to it, it is expensive AF. I happen to be in a position where I'm lucky enough that I can pay for these things out of pocket. In a minute, you will get to see Dr. J and I doing the most wonderful yet expensive alternative treatments to keep myofascial pain under control. Stay tuned.
With Botox, that affects your ability to function with those muscles, like chewing.
Right, because we're freezing trigger points to make them like faux latent points, right?
No, we're actually making the muscle less strong and less capable of contracting, which is where the pain's coming from. So we're making the muscle weaker. You can't make nuts, and the nuts are what hurts you.
Okay. See, I was thinking we froze them from when you were explaining that you freeze it so it can't really contract and
Yeah.
bug.
And that's what. Well, so a lot of people use the word freezing for numbing.
Ah, okay.
This isn't actually numbing. This is taking the muscle and telling it can't contract.
I had a tripod, but I was running out of the house. That's why I'm a little late. I was already late, and I was like, forget it. I'm just gonna have to hold this thing, and hopefully it works. Channel.
Mm-hmm.
It started off with me kind of in the middle of me trying to figure out what was causing so much pain and information myself, so I really couldn't provide much information to anybody watching. It was basically me just crying. I'm in pain, help me get out. And a lot of people were like, "There's no way you're in that much pain," you know. Now that I've been through it and things that I can offer and say, this is how I found out, this is what I have, these are the treatments, this is how long it took me to find these treatments, here's what these treatments do, and then all the other junk I have wrong with me. So anyway, I wanted to give them some insight, especially into this one, into this treatment, because it is a quality of life hinges on this one as far as, you know, being able to think, sleep, all that kind of. And it's wearing off because here comes first, and then here comes next. And I just want to make sure I get in before it really wears off. Yes, because as we know, it kicks off. It's debilitating. Well, that's something else I wanted people to understand too. The pain that you were in until you get taken out of it, and then you feel it again.
And listen to speakers. No memory. So if you buy some speakers for your car, you listen to them in one place, and you say, "Oh, that sounds fantastic." And a day later, you go to another shop and you hear, "Oh, that sounds fantastic. Was it better than the other one?" You don't really know. You can't make the comparison. Pain does kind of the same thing. You learn to accommodate to it, you live with it, dealing with it, that's your baseline, and all of a sudden when it's gone, it's like, oh, isn't this fantastic? And yet that's your new baseline. You still could be in a lot of pain compared to how you were before, but you don't really know, because one day to the next, you're adjusting your tolerable levels of what's acceptable or what's really killing you, kind of thing. It changes, so it's a moving target many times.
Well, it's a godsend. My goodness, I had seen it on accident. I'd come in because my dentist doesn't do like nitrous or whatever on the counter, and I have TMJ, and so I asked him about it, and then when he found out I had myofacial dysfunction, he was like, "Oh, well, that's your problem." It never occurred to me that it would be in my face, and that's what would be causing the pain. I never put the two together. That's why I love when I find a doctor who knows what myofacial dysfunction is. It is insane the number of physicians that don't know, and those who do are like, nope, they don't know. As soon as he said that, when he was like, oh yeah, I know exactly what the problem is, I was like, okay, I'll drive 40 miles.
You're even there. Okay. Nothing, and 4 is you're going to die if I don't move my finger. Or 3 is I'm going to die. 1 and 2 are kind of in between. So this is a 2.
Yeah.
Okay.
It's a little bit. Those are uncomfortable.
Okay, so anterior temple.
There.
Okay.
That's right there for sure.
Okay, nothing back here. Okay.
That's definitely. Yep. 3.
Okay, and 2 right here.
Yeah, that's not worn out yet. Let's move it up first. Right here.
So all the way up there.
Mm-hmm.
Okay.
Yeah.
You said screw bladder master.
Really?
Yeah.
Wow.
That was right where this muscle attaches in the mastery process. Check and see. Not too bad on this side.
Not
This
as
side.
bad. Not as bad.
It's over here. I'll have no trouble finding that. Okay. The right side is pretty there.
Yep.
And if you're hurting that much, call it whatever you want, but get me out of pain.
Yeah.
Um,
So this is good.
when you're,
Yep.
that's right. 1, 2, 3.
Right there.
Let's see if we can find it.
Yes, and crunchy.
Yeah.
One's in my neck and my crunchy too. Yep, right there. This one doesn't hurt as bad as the other side, but there it is. And I don't want to let it wear off because that's what seems to happen. Mess. The most painful right now. Not have a headache.
4 units left, but you don't have any wrinkles on your face anywhere, will you?
It's Neutrogena.
Yeah, Neutrogena.
Can we put extra in there?
Mm-hmm.
Okay. That seems to be always the problem area.
So these are actually,
Yeah, they're symmetrical. Yes.
okay, so I don't think this, I'm glad I can find them, but I don't want to hurt you.
I know. This is one of those, like, I'd rather have a little bit of.
Botox can help there, but so that's a freebie, and we'll see
Thank
what
you.
we'll see if it
So,
does anything.
what is the ligament attachment?
This is where you were sore. So is it because you've sprained your tendon a little bit, or is the muscle pulling too hard and has it not right in that area? So we don't know. We can't do anything for if it was a tendon strain, other than leave it be. But if it was muscle, the Botox is going to help, and that's why I gave you some right there to see if it's
All right.
if the muscle is close enough that it's going to help.
Awesome. Well, we'll find out.
Monday. Got that figured
So
out?
by like
So,
Wednesday.
like Wednesday late or something, or Thursday, you should start feeling the difference.
Alrighty.
Alrighty.
Thank you so much for this.
I
So,
want to hear nothing but good news.
well, hopefully, let's see. We're like, which is
It's
nice.
just, it should, and if we're lucky, we'll just we treat the muscles. The weaker they get, the less likely they are to spasm. And create
So
a knot,
yeah,
so it
I
might
was
get a
hoping we might be able to stretch out to like 6 months. Is that unheard of? Is that something that can be achieved?
Not well known in the myofacial pain world. In the cosmetic world, for wrinkles and things, people can get to 5 and 6 months. But when we're talking about some of these bigger muscles, I don't think we've done any research on that. But the same mechanism would apply.
I've got like this part of that. So, stay tuned for the next few. Almost had it. Favorite alternative treatments for myofacial pain, specifically facial pain.